Hello and welcome to the Treble Health Podcast. My name is Dr. Ben, your host. Today we are here to talk about hearing aids. The pros and cons of online hearing aids are an important topic because sometimes patients can get this wrong and end up buying hearing aids that they shouldn't have. Other times, patients in an in-person clinic can pay 2 or 3 times more than what they really should be paying for hearing aids. My name is Dr. Ben Thompson with Treble Health. I am here live in San Francisco with Ben Sun, who is the CEO of Orca, a new hearing aid company. Ben has worked as an engineer at Apple in California and decided to take a step into the hearing aid industry to help our market with more accessible and affordable hearing aid solutions. Ben, welcome to the Treble Health Podcast. Tell us a bit about why you started Orca.
Thanks for the introduction, Ben. So before I answer that question, just want to give a little bit more introduction of who Orca is. So Orca is what I would call an end-to-end hearing aid company. We design, engineer, and manufacture our own hearing aids, and we sell directly to our customers. On top of that, we have a comprehensive care platform that enables either in-person or remote hearing aid fitting with our audiology team. So the reason we started Orca was initially because of my own experience with my grandma. My grandma has hearing loss, and over one winter break, I took her to the audiology clinic to get a pair of hearing aids. And at the time, I was not quite satisfied with what the product was able to offer to my grandma, and then she stopped wearing them about 2 months in, and the price tag was really hefty as well. So from a product design point of view, I thought there are a lot of opportunities where we can use those new technologies that are currently used by the consumer electronics companies, and as well as a lot of the new deep learning algorithms, AI algorithms, to help hearing aids perform better in noisy environments. So that's why we started Orca, is to look at how we can make hearing aids more accessible, more user-centric, and fun to wear.
When we talk about in-person versus online hearing aid care and audiology care, this is a conversation we're only able to have in the last few years, because just in the last 5 years, really, online hearing aids became finally feasible. The technology was at a level where there was a smooth user experience to get hearing aids online, and the remote fitting, the remote softwares for the audiologists to program them finally were at a level that we were happy with. And we saw different companies come into the market that sell hearing aids online, some of them better than others. The main difference between in-person and online hearing aids is that with online hearing aids, most of the adjustments are coming through the phone. There's a lot of opportunity for self-adjustment and self-fitting of devices. And it's typically better for a person who has a higher degree of understanding with technology, probably has more apps on their smartphone, basic things like that. In-person audiology will always have a place. And what we found over time is that so many millions of people have a mild or moderate degree of hearing loss and are tech savvy. So if there is a hearing aid that can be programmed online, bought online, fit at home with some audiology support via telehealth, that is a completely acceptable way to treat your hearing loss. And now 2022, at the time of recording this video, we're only expecting that to increase with the adoption of telehealth and online hearing aids. So from your company's perspective, what are the words you have to say in terms of the benefit of online hearing aids?
Yeah, absolutely. So we're actually a big believer in online hearing aids. We're in this space a little over a year now. And what we're seeing, the biggest benefits is probably, the points you've already touched upon: convenience and accessibility to both the user and the audiologist. We're now, because of online hearing aids, we're removing the barriers of geolocation, and we're removing the constraints of time, really. But it is very tricky to make the online hearing aid experience accessible one. So over the past couple of years, we're seeing a surge in different hearing aids being offered for sale online. And now your hearing aid purchase journey all of a sudden look a lot like buying a pair of headsets online. And people start to treat them none different as well, but they shouldn't be. We will argue that the journey for most consumer electronics pretty much ends as soon as the box arrives at your front door. and then you're left on your own to figure out the rest. But for hearing aids, I think the consumer journey only starts when you receive the device. We have to make sure the in-clinic experience is captured and carried online. That means that the necessary process of getting an accurate hearing test results, having the hearing aid adjusted and fine-tuned over time to your need is so important for a successful experience. And from our own data, we're seeing that users who work actively with our audiology team over at least 14 days, they have a much higher satisfaction rate as well. So I think the key here is, even though now the transaction happens online, it's, buying hearing aids still isn't a moment, a transaction, it's still a journey. It's care and service driven experience that really guarantees a successful one. So
it is a mistake to think that buying hearing aids online, having them arrive at your house and doing it all yourself will fix the problem completely, because what happens is the brain has this adaptation period where the brain needs to reorganize and learn how to make use of all this new sound. There's some important adjustments that need to be changed to the hearing aids themselves to guarantee success with them. And sometimes the expectations are simply off, that hearing aids will cure hearing loss, that my hearing will be back to what it was decades previously, where just not the case. As you built this hearing aid software and the hearing aids themselves from scratch, you did your research, you met with individuals. What were the complaints people had? What were the improvements that people asked for as opposed to the status quo? What did you create based on the user feedback?
Yeah, so aside from those main pain points that a lot of companies talk about, like speech and noise, rechargeability, those are definitely the features that we were seeing from the users, and we're putting in place. We have very good Bluetooth connectivity. We have rechargeability. We have a very good denoise model where it enhances the speech only instead of everything else. But on top of all those, what we're seeing is a lot of users do come back, and audiologists even, they talk to us and they would bring up this topic of the ongoing care service model needs more insight from the user usage pattern. And this is sometimes lacking from a traditional care model. To give one clear example would be, right now the status quo is if you're experiencing a situation where you don't hear 100%, and you book a follow-up appointment with your audiologist, and you go into the clinic and you try to describe what the sound environment, the sound profile you were having trouble with at the time. And sometimes it's hard for the audiologist to grasp what exactly you meant by saying, it was a little loud, I couldn't really follow, that the sound was a little tinny at, a certain restaurant or place. So what we're working on with our partner audiologists is to really look at the necessary information, the necessary sound profile that we can capture in real world, in real time, as soon as the user starts to experience something uncomfortable. Obviously, with a lot of regards to privacy, and all of those data in the back end help the audiologist to make better adjustments over time to make the hearing aids better suit each individual's needs. So this is something that we see a lot of opportunity arises, especially with this new remote care model.
So it's not only the hearing aids, but how you customize them, how you can change them. And as we said earlier, with the nature of controlling your hearing aids from your smartphone, is that we want the control and the power to be in your hands, to be in the user's hands. So no longer does one have to wait until their next appointment to make the adjustment that they want. And that's a beautiful thing. As we're wrapping up here, I want to say thank you, Ben, and thank you for this wonderful space we're in San Francisco. We're here live. We were able to meet in person, and happy to share and talk about these important subjects. Who are online hearing aids for? Well, not for everyone, but quite a large percentage of those who are in need of hearing aids should consider the online treatment approach. We've been using telehealth at Treble Health for a long time, and it works quite well. With that in mind, Ben, thank you again for coming.
Thank you.
And we'll talk to you soon.
Thank you for having me. Bye.
Thank you for watching today's video with Treble Health. Check out our next video by clicking the button on this screen or another recommended video. And if you're not already, make sure to subscribe to our YouTube channel. Thanks so much. See you on the next video.